Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about when does physical therapy start after knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So I made a video a little bit ago about when can you end or when can you stop physical therapy. This video is answering when do you start physical therapy? And the answer is you start physical therapy the same day as your knee replacement surgery. So if you're in a hospital, if you're in the hospital on an inpatient basis or an outpatient same day recovery, you are going to at the very least touch base with your physical therapist that day of surgery. They're going to get you up out of bed, hopefully do a little bit of walking with you. If you're discharging home, either later that day or early the next day, they'll probably go over using an assistive device, using a walker, using a cane. They may probably go over stairs with you if that's something that's appropriate or needed. And just general guidelines, pain management, safe mobility, moving around in your home, and getting you set up for what's next. So you start therapy that day that you have surgery, and you'll have it each day that you're in the hospital. You'll have some physical therapy. And then when you return home, there's kind of two routes. So one route is being referred to home health therapy. So that is you have the physical therapist actually come to your home to work with you. This is for folks who getting out to an outpatient facility early on after surgery may be excessively burdensome or difficult. So these individuals will have someone come to the home to do physical therapy with them. Usually this goes for about 1 to 2 weeks, and then you transition hopefully to an outpatient physical therapy facility, are there for a number of weeks, and then are discharged and hopefully have a successful recovery after your surgery. Another route from the hospital is sometimes folks just need a little bit more assistance and help. They might be going home alone and they aren't really sure about that and doing that safely and effectively, and that you might be discharged to an inpatient facility. So the most common is like an inpatient subacute or acute rehab facility where you're getting intensive therapy services, you're getting physical therapy, occupational therapy. If speech therapy is appropriate, you'll get speech therapy services. And same thing, you may also go to a skilled nursing facility where you also will get 5 to 7 days a week of physical therapy, occupational therapy as appropriate. With discharge to an inpatient facility, unless you have a lot of other things going on, a lot of things that may prolong your recovery, prolong your ability to achieve a level of independence and mobility. Usually you're there for maybe a week, a couple weeks, but not very long unless there's some other complicating factor. So long story short, physical therapy starts the day of your surgery. You're doing physical therapy in the hospital, then you're going either to an inpatient facility or getting some home health therapy, or some folks, they might go directly to outpatient getting outpatient therapy services once they return home from the hospital. So it starts right away, and that early on period is the most important time. You really have to work on getting your range of motion, getting your pain under control. Lots of big important things. We're racing against the clock. As your body heals and your scar tissue forms, we want to avoid that stiff knee syndrome and as well we want to regain your mobility and your strength and get you back to feeling good and doing the things that you enjoy. I hope this answered this question. Please be sure to hit that like button if this was helpful. Please be sure to leave your comments, your questions below. Thank you for watching.